Now, for more on this, we're joined by Dr. Chandrakant Lahiriya from New Delhi. Dr. Chandrakant is a consultant physician and epidemiologist. Thank you so much for joining us on this broadcast.
Good morning.
My first question to you, the number of COVID-19 cases in India's national capital climbed to 300, as I mentioned earlier, which is the highest since September last year. What's your assessment of the situation?
What we need to remember that SARS-CoV-2, the virus which caused COVID-19, is around us. And as it happens with all respiratory viruses and illnesses, there are seasonal rise and fall in the cases. So the number of COVID-19 cases in Delhi and in India had gone down to a really low number. The only direction it could have gone is upward. We also need to remember that mere rise in the infection is not the concern. If infection results in the serious disease, moderate to severe illness, then it is a concern. So though the number of cases are rising, number of infection of COVID-19 tested individuals is rising, but we are not seeing the increase in the moderate to severe illness, and the deaths are very much stagnant. So of course, the numbers are rising, which is one parameter, but we should not be looking at numbers only. We should be looking at moderate to severe illness, which is not on the rise, and that is very assuring.
All right, so just for more clarity here, as of now, you would say this is just a seasonal rise and fall in the numbers and there's no need to worry as such currently?
I would say yes, this is a rise on the expected line. We never expected that there would not be any rise in the future. And this currently cases are rising. They would fall in the time ahead. In the future also, there would be regular rise and fall in the cases. But this surge would be very smaller in the number. But it's also a time that we should not be looking at the absolute numbers in terms of infection. It is high time that we change our tracking parameter to moderate to severe illness, hospitalization, and deaths. And that if there are changes in those, that should be the criteria for any worry. But immediately, as of now, it's not a concern from public health viewpoint.
All right, sir. Also, we've also seen a sharp rise in the H3N2 influenza cases in the country. What's your assessment of that?
So H3N2 influenza cases are making a lot of news, like for last 2-3 months. In influenza also, we know there is a regular seasonal rise and fall. Usually there are 2 seasons for influenza in India. One is June to August every year, and then second is starting December to March. These are the seasonal pattern. But what we have seen that this year there is a subtype of influenza virus, H3N2, which has been reported as major share of all influenza viruses. Other is H1N1. But we also need to remember that H3N2 is not a new subtype of influenza. Rather, in 1968, this H3N2 subtype of influenza called a global pandemic. So this is coming after a long period, and it is being reported to have a slightly severe illness, a longer duration, and persistent cough. And influenza, in my opinion, as of now, is a major concern, bigger concern than COVID-19. The reason is, for last 3 years, there was a lesser exposure of individual to influenza viruses because of COVID-19 related measures and protective aspects and wearing masks. And we know scientifically what happens because influenza viruses keep circulating around us. So if a population is not exposed to those circulating viruses, and as and when this preventive approach, such as COVID-appropriate behavior, have been removed, so we are now getting exposed to all circulating variants which has come in the last 3 years. And this is called immunity debt in scientific language, which means we were not exposed, so we did not develop immunity against this. So slightly higher rise, higher number of influenza cases in comparison of previous years. But again, I would say this is relative that H3N2 is slightly more severe in comparison to other variants, but flus are usually mild. In that H3N2, I would like to remind that most of the healthy adults need not to worry. But children younger than 5 years, which means 6 months to 5-year-old children, pregnant women who are in 2nd or 3rd trimester of pregnancy or just delivered, 65 plus year old population, or adults who have any coexisting morbidity, they should be little careful and they should wear masks when going to crowded places or when talking to some infected individual, a flu-like symptom individual.
All right. Now, Doctor, Delhi's health minister will be conducting a meeting today with the doctors of major Delhi government hospitals where COVID beds have been reserved. What would you say of the measures and the preparations? Do you think we're better equipped this time around?
So there are two things. One is a public health measure of government. If there are rise in the cases, it is right thing that government or government machinery takes appropriate measures to take stock of the situation. So the way I see meeting called by the government of Delhi is a standard procedure, and that's how government should be behaving. They should take stock of situation, and that's what is being done. Regarding the measures, I do not think that there is a need for any specific measure for COVID. In fact, we now know that in many countries, or including United States, where we have a granular data, there are other respiratory illnesses are more common than the COVID-19. So now our approach in India also, in Delhi also, not to focus on COVID only, but to focus upon all respiratory illnesses. We know that tuberculosis is more common infection. Tuberculosis kills many, around 4,000 people every single day in India. There are other respiratory illnesses. Flu also causes severe illness in hospitalization. So now our approach in Delhi and India should be focusing upon all respiratory illnesses. We should educate people about how to prevent from respiratory illnesses, adopt those healthy behaviors so they do not pass on the infection and they do not get infected. But preparation from the government side is fine, but it's not a reason for citizens to be concerned about that COVID is rising or COVID is going to be major concern. It is not going to be major concern in the time ahead. It is around us and it's a mild illness.
All right. Dr. Chandrakant, thank you so much for joining us on this broadcast with your insights on this. WION is now available in your country. Download the app now. Get all the news on the move.